back to my YouTube channel, and I would like to say I'm very grateful for your support, your subscription, watching my videos. It was amazing. And once again, I'm bringing you to a different topic on my video. So this episode, I think last week I promised that I was going to talk about LGBTQ plus, but I'm still brewing knowledge concerning that. But today we're just going to focus on what it means to practice occupational therapy in society. As I said, moving OT from the clinic and the hospital into the society. We're not saying that we should just ignore the traditional ways of practicing OT, but embrace new ways of practicing OT. It's going to be amazing, guys.
I needed to grab a seat so that I can we can continue with the dialogue. So basically, for me, my thoughts on this kind of practice is that it's a practice that we really need as OTs, because we have to understand that it's not only body impairment or like illness that impact on human occupation and what people do. Also, it's not only injury that also impacts on what people do, but also we should look at the broader picture, the macro level picture of how social, political, and economic and cultural factors actually affect what people do. And for me, I look at this in two directions. One, how human occupation or what people do actually solidifies, creates and entrench hegemonic factors in these socio-political structures. How these structures are created by the doings of humans. So, and then also we're looking at the direction where we can actually also use human occupation as a means to actually deconstruct or understand these structures and find solutions to human oppression and hegemony and inequalities and what have you in our societies. So basically, I believe that for us to take this charge, or for us to explore, there should be a wealth of discussions around it. As the discussions shouldn't be only for, but we should also have discussions that critique this kind of practice so that we actually have a better grasp of it, understand the complexities that is involved in taking occupational therapy or occupational science in that direction. So there's this article that I read, and it's by Laliberte Debbie Rudman, and he talks about occupational imagination. And I think that article is amazing because it gives you a sense of how you can actually dwell on the foundations and your understanding of what human occupation is, and then you move it from the individual factors and look at the broader picture. In terms of what the social, political, and economic, cultural factors actually impact on what we do. So and he also talks about helping people to understand their situation in a socio-political and historical sense. And I loved it because we have to understand that, like, how people behave and how society is structured have a history and has political holdings and underpinnings. So it's very necessary for OTs to actually understand some of these structures and how they impact on people and what people do, especially the vulnerable groups and the populations that they want to work with. So for me, I think it's amazing. It's amazing, that article, and I actually put that the link for that article at the end of this video for you to go read for yourself and have some wild imaginations and being innovative about this. Just using your understanding of what human occupation is and projecting it on the social order and social structure and social political economic structure, and how this you see, understanding that these structures are created by human doings, which we OTs call human occupation. And these structures, the damage that these structures has caused, we can actually use human occupation. These structures are created by collective occupation, and through collective occupation we can avert these structures. So shared understanding is very key when it comes to practicing in society or working with populations and averting social inequalities and occupational injustice and what have you. These are my thoughts on what I think is needed to practice OT in a society. And I also went into, talked to a few friends. I think I got two people, one from Ghana and one from South Africa, to give me their understanding on what it means, or on what it means to practice OT in the society. And I think it was amazing that one picked it from the occupational justice concept, and the other picked it from the social occupational therapy ideologies and concepts. And I think it was amazing because I would want you to actually listen to them, and then we talked about what they shared later.
Good day, everyone. I'm Dominique. I'm an occupational therapist, working and living in Cape Town, South Africa. And I am currently in my first year of Masters at the University of Cape Town. And over this past week, we have been introduced to the idea and the concept of social occupational therapy. Social occupational therapy, I think it takes it a step further, and it actually goes, it takes it off of the client, off of your patient, off of the individual, and looks at it on a macro level. So looking at the systems, the structures, the institutions that are put in place that can affect one's doing care, that can affect the individual. So it's quite an interesting take on patient and client-centered, because it still has a very client-centered approach, except you're not directly, or not all the time would you be directly working with that individual. And I think that's quite significant, and it also is quite important, because it also allows our discipline to really understand that in order to facilitate one's doing, or how one does, we have to look at the confinements or the opportunities and the systems that are around them. And I think that's quite significant, because it also shows us that even though we might not be working directly with the individual, we are still impacting and involving the human and the individual at the core, because through our indirect working, we are addressing the individual. And I think that's quite a powerful stance for social occupational therapy. And I think it just goes back to our readings and our other concepts within occupational science that help us understand what is human occupation, and re-looking at, to truly understand doing, and to understand how one is a occupational being. It's far greater than the individual. And I sometimes think that when we stick so closely to looking at the individual as an individual, we lose sight of the things that could be actually further disabling them. So in my personal experience working as a clinical occupational therapist at a district level hospital, I think that by using social occupational therapy as a lens can help facilitate a much better and effective treatment and management of patients that I see. But I also think as a discipline of social occupational therapy, it can be a more powerful tool when addressing maybe how a person even got to that hospital, how even a person got to the specific position that they are in. And I think it can be also used as a form of prevention in a lot of circumstances. So I think that if used appropriately and more developed and it grows, I think that social occupational therapy could be quite a exciting and world-changing branch for our profession. Thank you.
Hello everyone, my name is Eric Opoku, an occupational therapist from Ghana, Africa. I am going to explain my understanding of occupational justice and occupational injustice. As occupational therapists, I know that human beings are occupational beings and so should engage in meaningful and purposeful occupations. It is critical for their health and well-being, just as food and water. Occupational justice is a very important idea in occupational therapy, bridging the gap between people's well-being and harmful social conditions that may restrict what they can do and be. Occupational justice recognizes that all persons have rights to participate in everyday occupations regardless of age, ability, gender, social class, race, religion, and other differences. Every person has the right to engage in occupation that are meaningful to them and bring satisfaction to them as well. When these rights are curtailed, it represents occupational injustice. So any social structure, any system, any value, any culture, anything at all that prevents any human from engaging in a purposeful, meaningful occupation, that represents occupational injustice, because it is the rights of humans to engage in occupation. I am going to explain occupational justice in the context of play. Let's take play and children as an example. Children have the right to play. In fact, the United Nations Convention on the Rights of Children recognizes play as a right of every child. Play is critical to children's health and well-being, providing a medium for them to develop physically, cognitively, socially, emotionally, and psychologically. It is occupational injustice to deprive children of play. So, I am going to pose a question to all of us. Do we make conducive environments or create opportunities for children to play in our communities? In the first place, are our communities conducive enough, or do we create an enabling environment that children can play in? How many playgrounds can we count in our communities? Are they enough? Do children get opportunities to play at all on our streets, in our homes, in our schools? Are all of these places being made conducive for children to play? How many of these playgrounds are accessible for children with disabilities? How many of them are usable and playable for children with disabilities? If there are playgrounds at all and these playgrounds are not accessible, usable, and playable for children with disabilities, that represents an occupational injustice against children with disabilities, because they are also occupational beings and so should engage in purposeful occupations such as play. So any structure, any system, values, human behavior, that etc., that prevents anyone from engaging in meaningful, purposeful occupations that situation represents occupational injustice.
Okay, guys, I hope you enjoyed their thoughts on the issue that we are discussing in this video. And I want to see you same time when I post the next video. I just want to keep it as a surprise. So I want you to enjoy. Let's have a dialogue in the comment section. You can send your videos and let me hear your feedback. Peace.